Hi again. This is part 3 of my series directed to musicians who are interested in fast relief from their pain. In this video, I'll list some of the common complaints I work with as I treat musicians. Of course, the most common is tendinitis, which is the kind of inflammation of the tendons. And it occurs mostly in musicians in the hand, elbow, and in the shoulder. A tight muscle pulls on the tendon and causes inflammation where that tendon attaches to the bone. Releasing that tension can give immediate relief. So bursitis is really very similar. It's that same pull on that same tendon can also inflame the nearby bursa, which is a small capsule of fluid that cushions the bones within the joints. The carpal tunnel is a narrow passage where the flexor tendons of the hand pass through on the inside of the wrist. Muscle tension or inflammation in that area restricts and compresses the median nerve, which comes through right here. The origin may be in the muscles of the forearm or in the trigger points in the neck or even in the shoulder blade. Cubital tunnel syndrome can affect your elbow and ring and pinky fingers. The cubital tunnel is in your outer elbow here and can trap the ulnar nerve or the funny bone. Guitarists often get this from that strained position of their fret hand. Releasing the upper and lower arm muscles and the trigger points involved can be the simple, fast solution to that. Thoracic outlet symbol is the compression of blood vessels or nerves between the collarbone and the first rib. This can cause pain and swelling in the wrists and hand and the fingers, which can be treated by releasing the scalene muscles of the neck, which pull up the first rib against the collarbone. And back, neck, shoulder pain and strain can be caused by just holding an instrument in a certain way or tilting your head for long periods of time. Again, these are soft tissue problems that can be easily eliminated with the proper therapy. So the guiding philosophy of MyoLabTherapy is that the simple approach is usually the most effective. All of those above maladies are a product of the same problem, tightness in the soft tissues, not pinched nerves, worn cartilage, or deformed vertebrae or joints. These problems may be there, but they're normally the result of tension in the joints and bones and not the cause of the problem. As I've been saying, pain almost always comes from the soft tissues. So the key to effective therapy is precisely locating the origin of the problem and knowing what to do about it. So there's usually no need to endure lengthy periods of downtime as you wait the results of those passive treatments or recover from surgery. So if you suffer from any of these problems and your treatment has not been effective, you might just need to approach your pain from a different perspective. And MyoLabTherapy can get your body in tune so you can concentrate on your music. So contact me if you like. My information is here somewhere, and thanks for your interest.